I have watched all of the Bad Sugar series. They clarified everything that the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
Be prepared to have an open mind when you want to watch such a program.
If it's somebody else in your family starts showing signs that they might have it, it will make you more aware of it. Well, maybe they have diabetes.
Welcome to the show. Today we continue with our mini-series, Bad Sugar, with a live audience. And with me today I have Dr. Rashidi, Dr. Reddy, Dr. Brinegar, and Dr. Carpenter. And today the goal is to take questions from the audience. So let's begin right away with our first question. What's your question?
How do I get my husband to change his eating habits? He's a newly diagnosed diabetic patient, and he likes all the fatty food and the sugars.
Mm-hmm. And he doesn't like to exercise?
He'll do it once in a while. He's not consistent with his exercise.
And he doesn't understand the benefits of fruits and vegetables?
I'm sure he does. He went to a class when he was first diagnosed.
Okay. So any tips you want to add to that, any of you?
I think one thing we would try to work with is try to incorporate the foods that he likes in his diet. He's more likely to be responsive to a diet regimen that's catered for him. And the foods that he likes to eat, which is not healthy, which we all, fall into that trap, is to limit the portion size. So generally, a good way to do that is to start a meal with a little salad, which kind of makes you feel full, and then allow them to eat what they like to eat in a smaller portion size. And increasing proteins in the diet helps improve satiety. So it's going to be a long-drawn process. The steps are not going to, it's not going to happen overnight. Right. It requires patience, and most importantly, the patient should be willing to be helped.
Absolutely.
When his mind says, I'm ready, it'll just fall into place.
And also, with regards to exercise, he can start to take baby steps. Just do something. He doesn't have to go out and run on a treadmill. He can just walk around the block, maybe for a mile a day. Just start slowly, and gradually his body will start to crave for that. Okay, so next question.
Can the risk of diabetes be observed by looking on the back of a person's neck and noticing either a rash or a, quote, dirty looking spot or skin?
Right. Dr. Brinegar, you want to talk about skin tags and diabetes?
A little bit.
Go ahead.
What you're referring to is a condition called acanthosis nigricans. And it's, as you've described it, it's the appearance of someone that might have not washed their neck as well as they should. But it's really a pigment within the skin, and the risk of developing diabetes in a person that has that, children as well, is extremely high. It occurs in everyone, but more in those that are of dark skin, so that you can distinguish those black areas that are in the creases, not only of the neck, but other places in the body where there are creases. You might see those under the arms or under the breasts. And so if you find those, it means that there probably is some insulin resistance, which, as Dr. Reddy indicated, was one of the first things to happen in a person that will develop type 2 diabetes.
So it's found predominantly maybe in Hispanics and African Americans? Predominantly?
I think a lot in African Americans, Hispanics, dark-skinned people. What do you have to say? Any addition to that, Dr. Brinegar?
Generally, anybody who has insulin resistance will have that, but it is more easily seen in dark-skinned people.
Right. And if you are at home watching, most importantly, if you think you have that, please get it checked out. Next question, please.
Once a person is diagnosed with diabetes, What determines whether you put them on oral agents or whether you put them on insulin? And also, once they're on insulin, can they come off of insulin?
When we return,
You have to realize diabetes is progressive. So no matter, even the patient is very compliant with diet and exercise, we currently do not have medication that directly protects the pancreas from progressive damage.
then later,
I'm a nursing student, and I'm learning that a big part of our care is the physical aspect of it, but what about the psychosocial needs of the patient? How can we in the medical field really be there for them and support them in this disease process?
That is an excellent question.
So what advice do you have for the young children who are eating all these hamburgers?
Stop drinking soda right now. No matter what your mother buys, don't put it in your body.
Be careful and stop. That's the simple answer I can give. I mean, that's the shortest answer I can say is simply stop eating that kind of food and replace it with something more healthy. And I think that's the easiest way to go about it is, it's difficult to just stop eating something that you like, because it tastes so good. But I think if you can replace it with something else that you also enjoy, it'll make it a whole lot easier to stop eating the junk food. And I guess I can give an example and say that, for instance, I like to eat a lot of, I like peanuts, and so instead of eating lots of candies, I'd rather eat peanuts than candy because, candy is obviously bad, but nuts are good for me. So that's an example of what you can do.
And if you're a big fat kid or a kid on the way to fat, don't eat those burgers. They're loaded with fat. Just don't eat them. They're killing you. Throw them down. Don't even go in those stores. They're killing you.
It's kind of tough to tell people to just totally quit eating junk food altogether because most people can't or just don't want to do that. And, junk food in moderation or just a little bit isn't that bad. But if you could just limit yourself somewhat, if you're eating like fast food 10 times a week or something, if you cut it back to 5 or 7, that would be a start. Or if you could, if you're not eating many fruits and vegetables, if you could just maybe try to eat 1 fruit a day, just start small and see if you feel better, and you probably will. And, see if that gets you inspired to do more.
What do you have to say to the parents who buy it for them?
You're a fool. You don't care about your children. You do not care about your children if you buy that junk. You're in too much hurry. Busy, busy, busy. I got to do the job. I got to run. You don't care about your children. That's what I say to the parents. You don't care about your children.
Keeping in mind that a parent is supposed to protect the child and to nourish a child in the proper way. And if it's being difficult, I think it's easier, I guess, to break things down a little bit and go slowly, because sometimes it's so easy to ignore your child and focus on yourself, even though you're supposed to take care of the kid. But if you just look at the kid and realize that your responsibility is to take care of the kid and to help them be a good individual someday, then I think you should, take a step forward and a step back and look at yourself. You look at your life. You have to make sacrifices, obviously, and try to help the kid. It's important to also be affirmative. You should be assertive. When the kid is, just because the kid is crying and rolling on the floor for that candy doesn't mean you should give in to them. I think being assertive is also one important thing that parents can do, in spite of maybe not even having a lot of money to, provide what we call, a good diet for a kid.
Next question, please.
Once a person is diagnosed with diabetes, what determines whether you put them on oral agents or whether you put them on insulin? And also, once they're on insulin, can they come off of insulin?
I think we consider a few factors to make a decision about treatment. It is the level of sugars and how long the sugars have been elevated. The type of diabetes, as I told you, type 1 needs insulin, so there's no question of oral agents. In type 2 diabetics, those who have blood sugars that are just marginally or moderately elevated, we start with diet, exercise. Then we go to oral agent therapy. You have to realize diabetes is progressive. So no matter, even the patient is very compliant with diet and exercise, we currently do not have medication that directly protects the pancreas from progressive damage to the level we would like them to do. So the diabetes gets worse over time, so the same patient would need oral agents. But if you have a new patient coming in with very high sugars at type 2, and the ketones are positive, then we start them on insulin. These patients, over time, if once they take insulin, give some rest to the pancreas, do really well with diet, exercise, they can get off insulin usually by about 4 to 5 months, and perhaps they can be just diet and exercise control,
Absolutely.
or may need some oral agent to keep it going.
If it is caught early, I think Dr. Brinegar said that prediabetes, it can be reversed, okay, with lifestyle practices. We have plenty of research suggesting that you can reverse prediabetes.
Yes, I would like to know, will a person who may have swollen legs or ankles, feet, and have trouble walking sometimes with pain in their legs, would that necessarily be an indication that maybe that person is having a diabetic reaction or symptoms that are coming on that would suggest that they need to be screened for diabetes?
Well, I would say yes, in that diabetes and cardiovascular disease run hand in hand. When we see swelling around the feet and legs, a lot of times that's an indicator that there's cardiovascular disease. So definitely they need to be seeing a doctor, and one of the things that they will be screened for is diabetes.
Next question.
If you have a reaction when you eat sugar, you get an instant headache and dizziness, is that a sign that you could be a diabetic, knowing that you have, out of 6 siblings, 4 have hypertension?
You have what? I didn't understand the last part.
Out of 6 siblings,
Okay.
4 of them have hypertension.
What do you say to that, Dr. Rashidi?
Well, I would strongly suspect, given the family history that you're stating, that you may have a predisposition for not just hypertension, but for diabetes. We sometimes refer to a syndrome called metabolic syndrome, kind of another name for prediabetes. And as the glucose gets disordered, the blood pressure goes up as well. So you definitely should be screened. And if you have both high blood sugars and high blood pressure, you are at further risk for cardiovascular disease. So it's definitely something you want to be aware of, so that you can be making changes to your diet, lifestyle, exercising, and all of these are things we all kind of know we need to do, but when you get the word that you have diabetes or even pre-diabetes, you should be really paying attention and realizing that you can totally prevent and or reverse pre-diabetes if you are willing to put in the effort that it takes to make a difference.
Can hypertension be reversed?
Absolutely, it depends. Dr. Brinegar, you talked about that on the series. Could you please stand up? When you say hypertension, what readings are we referring to here? We have stages.
Just high blood pressure, you're on medication. Can you ever get off the medication?
And the answer is yes. And the way that happens is through some specific things that you can do with, again, lifestyle elements of caring for any disease, having weight go down to the level that it needs to.
Right.
And we talk a lot about that, and I know that that's difficult, but it's very important when you're thinking about how to normalize blood sugars or blood pressure or blood fats. If a person merely exercises, it will have an effect on lowering blood pressure. If they've learned how to manage stress in their life, not getting rid of the stress necessarily, because some of us can't do that, but we can learn how to manage that. And with those changes, with that change of lifestyle, there are many, many good things that happen, and one of them is that blood pressures will usually go down and be down in the normal range. So the answer is a resounding yes, that you can reverse it.
And with regards to blood pressure, you want to really cut back on salt. Okay, the recommendation is 2,400 milligrams per day. That comes out to about a teaspoon a day of salt.
With childhood obesity being very common now, are you diagnosing more children with type 2 diabetes?
We are seeing a lot of type 2 diabetes starting from the age of 9, 10 onwards in children who are associated with family history of diabetes and obesity. So it is mandated now that children, we have what we call body mass index charts for them, which are age specific, and if they are above the body mass index, which is a formula of the height and weight, then we do screen them for diabetes, for cholesterol, for blood pressure. And it is also being said that this generation of children are much sicker than their parents or
Yes.
previous generations. You're going to see this generation have bypass surgeries by the age of 30s because of the high risk of obesity, cardiometabolic risk factors, and diabetes with that.
Now, I have a question for the dentist. I know that we're going to get there. Now, Dr. Carpenter, do you see in your practice children, childhood obesity coming with dental problems as a result of poorly controlled diabetes?
It hasn't been a factor.
Okay, that's
our
good.
practice. I want to say something.
When we return,
My mom has diabetes and her bones are so fragile. She just recently cracked her rib and broke her toe. So is that due to her having diabetes or her bones being so fragile to break?
Could be a combination of many things. Dr. Brinegar.
It's a combination of many things.
Yes, it is.
How come I'm getting all the hard ones?
coming up on the next episode.
We are discussing diabetes and it's becoming a prevalent topic, but why do you think it is so difficult for people with diabetes to adhere to their diets?
Do you think that people who eat fruits and vegetables can live longer and feel better? Tell me what you think.
I do. I think that has a lot to do with it. I think a lot of people that eat healthy, like, you know, I have relatives that eat, that's how they eat, and I mean, they're still going strong to this day. So I mean, it's got to do something. I would for sure say that it does.
So what advice do you have to offer to people who don't really eat well and yet they don't think it has a relationship with disease?
Well, they need to start eating more healthier because it's better for the digestive system and it's better for them health-wise because there's so many chemicals in foods today. So they don't know, they want to eat natural and healthier today.
Tell me about exercise and disease prevention. Any thoughts?
On exercise, it's very well because it's good for your figure, for one. And another thing is that it keeps your metabolism, you relax better at night, and it keeps you going, and it's healthier for you, and it makes your skin pretty and makes you look nice at 47, like me.
You need to exercise at least 3 times a week, you know, or just go out and do something, even just walking around, because so many people these days sit in front of the computer in the office all day long and kind of neglect their bodies for that. I think that can be a really bad thing to do.
Now, I have a question for the dentist. I know that we're going to get there. Now, Dr. Carpenter, do you see in your practice children, childhood obesity coming with dental problems as a result of poorly controlled diabetes?
It hasn't been a factor.
Okay,
in
that's
our
good.
practice. I want to say something. I see people who are talking about your husband and these lifestyle changes for me were very difficult. But if you want to help this person who is diagnosed with type 2 diabetes, walk with them. You know, because I've been successful in exercising myself, and I exercise 4 days a week for 40 minutes hiking, and my wife goes with me, and my daughter goes with me, and a friend. And then we have a cup of coffee afterwards, and there's accountability. But you have to be willing to make the same sacrifice if you want them to live. So get out there and exercise with them. When you go out to eat, you know, Barbie and I will split a meal, and we love to eat out. And we're at that age where we have the money to do so. But split it. And the good times, I don't have to go to the psychologist anymore because my psychologist is talking to my wife and daughter, and I look forward to those times. So make it fun.
I have a 14-year-old type 1 diabetic who's an athlete.
Come join your mom.
Sarah.
Sarah, come on. Sarah was featured in the Bad Sugar TV series on almost every episode.
Well, she's doing fabulous, very healthy, but she's exercising so many hours a day with volleyball and basketball and playing games that we're having trouble combating the low blood sugars. We are very careful with diet and very careful with the insulin, and we still get low after so much exercise.
Low blood sugars.
Yes.
Of course, we know that exercise can be as effective as insulin in some cases. So, and she's a teenager going through the hormonal changes with the fluctuating blood sugars. So, I mean, these are things that are accounting for the fluctuating blood sugars, in my view. What do you have to add to that, Dr. Reddy?
Is she on a pump?
Yes.
Do you suspend the pump during exercise or put her on a temporary basis?
Yeah, we disconnect the pump during exercise. It's
Yeah,
strenuous.
the other thing that you can do is have, some quick source of carbohydrates Just prior to exercise, monitor during exercise, and continue your quick source of carbohydrate intake, which is simple sugars. Could be your Gatorade or things like that, or juice during the exercise. Sometimes it helps to suspend the pump an hour or two earlier prior to exercise if you can pre-plan that, which also helps. So it's by trial and error. You have to figure out how soon before to suspend, what rate you need it, and how many grams of carbohydrate you need for that particular activity.
And after that, it's recommended to eat a meal with complex carbohydrates to stabilize the blood sugars after that.
My mom has diabetes, and her bones are so fragile. She just recently cracked her rib and broke her toe. So is that due to her having diabetes, or her bones being so fragile to break?
Could be a combination of many things. Dr. Brinegar.
It's a combination of many things.
Yes, it is.
How come I'm getting all the hard ones? What I generally tell my patients, I have to lean out to be able to see this lady. What I generally tell my patients is that almost every condition is worsened by uncontrolled blood glucose. To me, there's no specific relationship between osteoporosis and diabetes per se. And there are some drugs that we use in diabetes which can, or in the treatment of some other endocrine diseases that can cause osteoporosis or at least contributed to them. But nothing that I know specifically that would link osteoporosis or fragile bones to diabetes, except as just a general statement of it being out of control.
If I may add, there is data that links diabetes to osteoporosis. Diabetic women have been shown to have higher incidence of osteoporosis, which is independent of the level of blood sugar control.
Dr. Rashidi, anything you want to add to that?
Well, diabetes and sugar in the blood commonly increase the production of acidity or acidosis, and the body uses calcium from the bones as its main source of a way to neutralize that acid. And so that is going to draw calcium out of the bones. And so that's one factor there. So certainly avoiding, as you probably already know you should, avoiding all sweetened drinks of any kind and just stick with water. And keeping up with calcium intake is going to be very important for that particular individual.
I am Ruth Tanyu, producer of the award-winning TV series called Bad Sugar. Do you have diabetes? Know someone who has diabetes? Unfortunately, all of us do. So listen carefully to what others are saying about the bad sugar DVDs.
I have type 2 diabetes, and I've had that for probably 30 years.
I've had diabetes since 1995.
I've watched all of the Bad Sugar series.
I have had diabetes since 1998.
I've watched the TV series Bad Sugar.
I'm a type 1 diabetic, and it's taught me how I can expand my lifestyle. It's taught me spiritually how to monitor my stress.
They clarified everything that the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
Oh, I thought I knew, but I didn't. I had little knowledge, but that series expounded my knowledge.
For me, Bad Sugar have played a major, major, major important role in my life to control, to educate, and to teach others about diabetes.
It showed how God operates through us and how we need to connect with God in order to make sure that those sugars operate the way that they're supposed to.
Bad Sugar.
Do you have questions about nutrition and diabetes? What to eat, what to avoid, counting carbohydrates? What about the glycemic index? Or questions about proteins, fibers, fruits, vegetables, fats? Or do you have questions about exercise, stress, spirituality, and diabetes? Or do you want to prevent diabetes complications? The Bad Sugar DVDs will give you the answers you are looking for.
There was things out there that I didn't know, and since I watched Bad Sugar, it's given me a lot of information that will help me further out.
Type 2 diabetes affects a lot of different things in your body. which I never knew about until I saw the episodes 7, 8, and 9.
It's taught me about nutrition, it's taught me spirituality, and it's taught me how to live my life and enjoy myself longer.
I was able to reduce my medicine, and that's due to the fact of the bad sugar.
Call 1-866-257-3471. Operators are standing by. Or log on to PreventiveCareWeekly.com and place your order.
Okay, now you know all about the Bad Sugar Diabetes DVDs. Get them for yourself and they will change your life.
To order a DVD, go to our website, PreventiveCareWeekly.com.
I'm a nursing student, and I'm learning that a big part of our care is the physical aspect of it, but what about the psychosocial needs of the patient? How can we in the medical field really be there for them and support them in this disease process?
That is an excellent question. I wish we had a psychologist here, but I'm sure all of us have experienced that with our patients because diabetes has a lot of denial component to it. So what I do with my patients, really, I work with them where they are. If they are in the stage of denial, I try to let them know that, you know what, this is real, but work with them slowly to accept that, and a lot of support, emotional support, and help to educate them, because research has shown that the diabetic patient who is educated fares well overall. So anything you want to add to that?
You know, being there for that patient and letting them know, I think, is huge.
Absolutely.
And don't underestimate just, you know, letting them know that you care. And then I think it's really helpful to let people be aware. I don't think it's commonly understood that you can reverse diabetes.
Absolutely.
In many cases. Give them that hope and make them aware, get them into the education that'll help them to understand how to do that.
And Dr. Reddy, anything you want to add to that?
Yeah, I think one part of the problem also is, as providers, we need to realize there's a lot of yo-yoing, as we call it. So patients have the periods of motivation and then demotivation, and they need the emotional support during the demotivation period, which could be precipitated by other personal stresses in their life. So sometimes, beyond your own counseling, they may need to see a psychologist, or they need short-term help with medications, etc., which you should be able to counsel and provide the patient in an appropriate fashion.
And the Bad Sugar series, we have a whole episode on that where the psychologist gave some tips. Dr. Brinegar, anything you want to add to that? This is a huge area, so I want all of us to share some tips. Because
that's an easy one. The reality is I think we all ought to be assigned a psychologist when we are 18 or 21 years of age. And we don't get our Social Security unless we keep up with the appointments every year. And the same thing with patients that we see in the office. I think that after I've seen them and my diabetes educating nurse has seen them, that it's well for everyone if that were possible. And I think it is possible in the ideal setting, where a psychologist would merely introduce themselves to the patient and ask a few questions that would maybe alert them to a problem, then let them know that they are available to be able to speak to them at times when appointments can be arranged. We're not whole persons unless we have our psyche together.
And Dr. Carpenter, anything you want to add to that? Your personal experience? Or?